here's a question that I hear a lot. Can I actually ask for a C-section even if there's no medical reason? Well, the short answer is, in the UK, yes, you can, but it's a big decision. A planned or an elective caesarean section can be the right choice for some women, but it does carry risk. So I'm Brooke, I'm an obstetrics and gynecology doctor, and I want to talk through why someone might request one, the pros and cons, what you can expect on the day of a caesarean and what recovery is like, so that you can feel prepared, so that you can go in and have an open conversation with your maternity team. So what is a maternal request caesarean? Well, most caesarean births are done for medical reasons, like your baby's breech, or if you have complications in labour and baby's in distress. But in the UK, where I work, 10 to 15% of the caesarean births are maternal request. That means they're done without a medical reason. The guidelines are clear. If you feel that a caesarean section is right for you, your midwife and your doctor should support you to have the birth that you want, after making sure that you understand the benefits and the risks. So why might someone request a C-section? Well, there's lots of reasons. Some women feel an intense anxiety about having a vaginal birth, especially if they've had a previous traumatic birth or if they experience tocophobia. Others like the idea of certainty. They like the idea of knowing the date that their baby will be born. It gives you an element of control and being able to plan your life. For some people, it is about having control. For some people, it's about feeling safer with a planned caesarean operation, rather than the unpredictability of labour. So what are the benefits? Well, one of the biggest advantages of having a caesarean is certainty. You know when and how your baby will be born, which can help with planning childcare, work, or family support. It also eliminates the risk of vaginal tearing or injury to the pelvic floor, although you will still have some element of pelvic floor injury just from having been pregnant. It puts stress on the pelvic floor and increases the risk of incontinence later in life, but there isn't that risk of pelvic floor injury at the time of birth, which can affect about 6 to 10 women after vaginal birth to some degree. Also, planned caesareans are usually calm and organised. When you arrive, you meet the team, things happen step by step. They don't have that panic and unpredictability of labour. Now, it's also important to know that even with the best laid plans, babies can have their own plan. You may go into labour before your planned C-section date, or you may develop a pregnancy complication. So it's always a good idea to have a plan B, because you might have to either come in for your caesarean early, or you might have to come in labour and then decide what to do. So what are the risks? Well, this is important. A caesarean is major abdominal surgery. It's often glamorized, it's often minimized. People say it's the easy way out. It's absolutely not the easy way out. Because it's a major abdominal surgery, it means there are risks associated with it. And the risks of the surgery are higher than the risks to the mother of having a straightforward vaginal birth. It's slightly different how the risks affect the baby, but from a mother's perspective, a caesarean birth is a riskier option. There's risks of infection. About 6 to 10% of women who have a caesarean section may develop a wound or a womb infection afterwards. There's a risk of blood clots. That risk is about 1 in 2 per 1,000, which is less than 1 in 1,000 after a vaginal birth. There's a risk of damage to the local organs like your bladder and your bowel, which sit nearby. And you can have a longer recovery. Women who have a caesarean section are more likely to need help with their day-to-day activities in the first few weeks after birth. They're likely to be in more discomfort and pain after birth than if you have a vaginal birth, which is definitely painful at the time, but that pain mostly goes away apart from some perineal pain after birth. So that means that the recovery after a caesarean section can feel like it goes on for longer. There's also a risk to future pregnancies. There's a risk of complications in the future when you become pregnant again after a caesarean. For example, a risk of placenta previa or placenta accreta, where the placenta attaches abnormally to the scar from your previous caesarean. Some people can also develop scar tissue in their abdomen after having had any type of surgery, and that can impact future surgeries, and it can cause chronic pain from that scar tissue. And in terms of the baby, if they're born before 39 weeks, there's a slightly higher chance of needing help with their breathing after birth, because their lungs may not be fully mature, or they may not produce one of the chemicals that they need to help their breathing after birth. So it's really about balancing the risks of the caesarean with the benefits. What about recovery? So recovery from a planned C-section can be really variable. One of the parts that people struggle with early on is bloating and constipation. So peppermint chewing gum is a great hack. Now, the reason that you might get constipated after a caesarean is not usually what people think, which is because they haven't eaten so much in the days before the surgery. It's not a lack of food. It's usually because during the surgery, your bowels may have been touched by the surgeons and they can become sluggish afterwards. So chewing gum or peppermint water can help your bowels to get moving again. So after a cesarean, you'll usually stay in hospital for around 1 to 3 days after an elective cesarean. You're encouraged to get moving early because that reduces the risk of getting blood clots and it speeds up your recovery and of course gets your bowels moving. Most women take around 6 weeks to fully recover, but it varies. You'll need to avoid heavy lifting and take pain relief regularly, definitely for the first week, and in the second week you can take it as you need it. Your scar is usually placed low on the bikini line and it should heal well, but it does need good wound care in the early weeks, keeping it clean and dry and not using any kind of creams or things that might irritate the area. So, with all this information, if you feel that a cesarean section is the right choice for you, think about what you might also want to happen in other eventualities. Think about that plan B, and I've got a separate video about planning your birth plan if that could help. Ultimately, what you need is a really good discussion with your medical team to balance the risks and the benefits of a cesarean section in your case, but if it's something you want, go for it. So do you want a cesarean section in any scenario, or do you only want a cesarean section if you go past your due dates? These are some of the things, the scenarios that you should think about with your medical team. And there's no right answers here. It's worth discussing the different scenarios with your team members. So what happens on the day of surgery? Well, before the surgery, you'll usually meet with your surgeon and an anaesthetist. You'll come for some blood tests and some swabs, and then you'll receive instructions about when to come in on the day of your operation, when you should stop eating and drinking, and any special medications that you might need to take before the surgery, like an antacid. Usually, you come into hospital on the morning of the surgery. You'll meet the anaesthetist and the surgical team, and most elective cesareans are done under a spinal anaesthetic, which means that you're awake, but you're numb from the top of your waist all the way down. That whole operation usually takes about 45 minutes, and your partner can usually be with you throughout as long as you're awake. Now, you'll meet your baby almost straight away. Sometimes even you could have skin to skin in the theatre. If that's something you want, you can discuss it with your midwife as well. You can also make your own preferences known, like if you want to have music playing during the cesarean, or if you want a delayed cord clamping, or if you want to have the drapes drop to see the baby coming out. So if you're considering a cesarean section, the best approach is to ask about it early, tell your midwife or your doctor your reasons, whether it's anxiety, whether it's past trauma, or just how you feel about labour in general. Your team should discuss the risks and the benefits with you, but importantly, if you still want a cesarean, your choice should be respected. If your doctor's unable to support your desires, then you should be offered referral to a colleague who can actually help to facilitate that request. So, should you ask for an elective cesarean? Well, it depends on you, it depends on your health and how you feel about birth. For some women, it's absolutely the right decision. For others, a vaginal birth is a better choice and gives them lower long-term risks. What matters most is you're supported in making an informed choice. So if you are planning to ask for a C-section, is there anything else that you want to know? Let me know in the comments below.